Hello all, and welcome to Post-Concussion Syndrome. My name is Miles Laptop. I used to be a hockey player. Now I'm a York U student, and in the future, I hope to gain more clinical experience with regards to concussion and post-concussion syndrome. So today, we're looking at video 1 in a 5-part series talking all about the brain, specifically focusing on concussions and post-concussion syndrome. We're also going to talk about recovery and things like the Buffalo Concussion Treadmill Test. And these videos are going to be geared towards athletes and clinicians. So some will be geared towards athletes, some will be geared towards clinicians, and it'll be explained for everyone. So the first one, I hope that everyone is listening to. The second one will be athletes. The third will be our clinicians. The fourth will be athletes again. And then the fifth and final one will be for clinicians. So we're going to talk about concussions. What is it? How is it caused? How does it affect sports, recovery time, and also acute, so this is our concussion, to prolonged / persistent / post. All this terminology is interchangeable, and it is defined as PCS. So what is it? A concussion is a functional injury. So bruising / swelling is a myth. All right, so if we're looking at traumatic brain injuries, the image A and D are the same, the image C and F are the same, they're just color mapped. So when we're looking at A, this is a mild traumatic brain injury, otherwise referred to as a concussion. We're looking at this white rim. So we see it's nice and consistent. Everything here on this imaging is unremarkable, which means there's no findings, nothing to note, no abnormalities. Structurally, it is sound. This is a severe TBI, traumatic brain injury. If we look at the white rim, we notice, that's not the same. And we notice all this color leaking outside. So this is our bruising, swelling, our cerebral edema. This is a severe TBI. This is significant findings on this CT scan. So our concussions are functional injuries, not structural injuries. Everything beyond that, a severe traumatic brain injury, will have findings on imaging. So what is it then? Well, it's those functional changes from a neurometabolic cascade. And if we're looking here, there is a lot going on. We got 1 to 9 steps with also some steps over here. What do I want you to focus on? Increased membrane pumping. So increased ATP usage, increased energy usage. Here, decreased energy production. So we see we're using more here, we're producing less here, which is creating an energy crisis. So how's it caused? Well, as I kind of mentioned, that traumatic brain injury, this is a mild one. A concussion is a mild TBI. It can be from a direct impact. It can be from acceleration, deceleration, so think like whiplash in your car, or from a blast brain injury, so like a shockwave type of injury. This is outside the scope of this presentation. We're only talking about acceleration, deceleration, and direct impact. How does it affect sports? Well, over the years, you've likely have noticed lots of rule updates, lots of rule changes. Some in hockey, some rinks are going so far as even coloring the ice differently as you get closer to the boards. There are also some laws that even get changed. One that we're going to make note of is Rowan's law. So this graphic I have on the left here, hit, stop, sit. If there is a hit that you suspect is a concussion, then that person must stop and they must sit out the remainder of the game. So any mechanism of injury, any of the symptoms here, and they have to sit out and go into their return to play protocol, which we're going to be talking about in the future. So does our clinical recovery match metabolic? When we talk about recovery, altered cognitive function lasts 1 to 2 weeks. Our cerebral blood flow, though, is returned to control at approximately 30 days. And this was found in 7 different studies. We're looking at this graphic here. So there's many different things going on in the brain. These are all different measures of brain function. And we're comparing 24 athletes with a concussion to 122 control athletes. This white line here is our control over time. We see decreased here, increased here. And what we're looking at is early injury. This is within a few days after the athletes were injured. They had these brain scans done. And we see some are decreased, some are increased. This is the athlete's return to play. So that means when they were clinically recovered and cleared to play back into their sport, they had another scan done. And if we notice, only one of these returned to normative data. This one kept increasing. This looked about the same. This one decreased even further. Even up to a year after their return to play, we see some of these still haven't returned and some have. So when we're talking about clinical recovery, it's likely that it's not equal to physiologic recovery, metabolic recovery, or muscular recovery if we're thinking cervicogenic. And that's something to make note of in the future when we talk about that in the upcoming videos. So ATP return to baseline timeline. So I highlighted energy crisis. There's an increased usage and a decreased production. N-acetyl aspartate, NAA, is correlated to ATP. What we're looking at here, we can take note of these white bars. For our controls, we see the white bar is about this. And just to highlight, we're looking at NAA, not ATP, because the only way to measure ATP is to actually cut into someone's brain, whereas NAA can be measured through scans. So obviously, these are athletes, humans, not cadavers. So time post-injury. These NAA values, what we're looking at, significantly decreased, significantly decreased, significantly decreased. Here, no longer significantly decreased from control, and that's at 30 days. So these were in human trials, and it took 30 days for their ATP to return to baseline. These indicate significant from the time period before. So important to note that it lasts, this ATP energy crisis lasts at least 22 days. So for our acute concussions, how do we return to our occupation? Our occupation, sport, work, learning. And again, this is our clinical return. So not the energy crisis, not the physiologic traits, just clinically, how can we get back? Well, for our return to sport, we're looking at a 6-step process: limited activity, light aerobic exercise, sport-specific exercise, non-contact training drills, full contact practice, and then back at it. For our returning to school and work, there's a little bit less steps, but we're still looking at daily activities, then school/work activities, usually done at home, return to school part-time. So this is likely on an alternating day basis or maybe on part days, and then returning to full-time. So acute concussion to PCS. This is our prolonged concussion symptoms, persistent concussion symptoms, post-concussion syndrome. All these names can be used interchangeably. In the literature, they are leaning towards persistent concussion symptoms. But again, all these things are interchangeable. So a concussion can generally be considered as an acute injury, because we see some altered cognitive function returns after approximately 2 weeks, and even that ATP to baseline is about a month. So any persistent symptoms beyond that are likely due to some subtype pathophysiology. What do we mean by subtype? Well, there is likely some physiologic dysfunction, vestibular ocular dysfunction, or cervicogenic dysfunction. Now, recovery time. There's no set timeline for recovery from any of these subtypes, so there's no specific timeline in the literature. What we do know is that prolonged rest may not be beneficial for recovery. Specific active rehabilitation techniques for each type are the most advised treatment options. There are also some additional treatment domains that expand beyond the subtypes. So when we think subtypes, we're thinking the vestibular, the ocular, the cervicogenic, but there's also some as well as early education, cognitive behavioral therapy, and aerobic exercise. So in the next video, I'm going to be talking about physiologic PCS, active and aerobic recovery for athletes, and also how to safely use a return to sport guideline. It's going to be important if you want to get back into the game or back to your work. Thank you so much for watching. I look forward to seeing everyone in the next video.